We have with us Dr. Devi Prasad Shetty, Chairman and founder of Narayana Health. Dr. Shetty, have we in Karnataka or India reached a peak, or are we still peaking as far as the cases of COVID are concerned?
Whether Karnataka, India has reached a peak, no. We will be reaching the peak by end of this month or early next month. We are about a month behind US.
Some say countries like South Korea have had many more tests, unlike us. Have we been frugal with tests? Should we also start testing more?
Testing may not help treating the patient that much, but it will definitely help in segregation, quarantine, and also a localized lockdown if required. I'm sure it's a matter of time before we will be able to scale up our testing facilities.
They say Indian immunity is very high. Is it true or is it just a myth?
Whatever is the theory behind Indians being immune, for practical purposes, we should assume that the virus will behave exactly how it has behaved in China, US, Italy, and Europe. Let's assume that way rather than thinking that the virus will behave differently. And also, for all the practical purposes, let us assume that Indians are like anybody else. But whatever the contradictory opinion, if it is true, we will be the happiest people. Always prepare for the worst, and if good things happen, it's very good.
Will everyone eventually be safe?
I do hope and pray to God that the virus is less potent in India compared to how it was in the other parts of the world. But for all the practical purposes, for us to prepare ourselves, let's assume that the virus behaves exactly like how it has behaved uh, in rest of the world, and human beings like us also are like others.
Sources are indicating that there is a rise in OCD, panic attacks, anxiety neurosis during these times. Will that worsen someone's immunity if one is very afraid?
I want to make a very clear statement that 21 days lockdown should bring down the mortality by at least 50%, provided we follow it up with all the measures like testing, local lockdown, and rigid adherence to social distancing. Now the ball is in the court of people, not in the government.
People are downing vitamin C like water. How much will that help?
People can drink and eat anything, vitamin C water or garlic or whatever they want to improve immunity. If they like it and if it is not dangerous, let people do what makes them happy. But there is no scientific evidence to prove because COVID has been in the circulation only for 3 months, so nobody can give an authoritative opinion.
Some suggest a proper regimen of good sleep, nutritious food, good exercise. This works better to build immunity against COVID. Is it true?
Everything what you talk about, good sleep, nutritious diet, good mental health balance, definitely will help build the immunity.